You think being next to me.
Okay. Is it on again? Steph, can you check?
Oh, bless you, bless you.
Okay.
It's cold in here. It's cold in.
Okay.
Okay. All right, guys.
We're
Steph,
back.
you go turn the heat on. That's right. They're cold.
Just turn the heat.
All right, we're back, guys.
We're back.
Hi, we're back.
Okay, so we're going to do a little
What-
range of
what-
motion
let's
exercise.
give everybody a minute to
Hey.
log back in.
Get back on.
Yeah.
Some reason we logged off when we were trying to work with the camera for some reason, but you know, we'll get back on.
Yeah.
Everybody get back on. Tell me where you're coming in from.
Or you could ask any questions if you'd like.
Yeah, go ahead and ask a question.
Nashville, all right. Dayton, Ohio. All right, well, people are.
Okay,
Washington, right.
So Washington State.
And I've never heard of Tumwater.
Tumwater.
Tumwater, Washington? Nice.
Tumwater. Yeah.
Hi, Tumwater.
Tumwater, Washington.
San Antonio, Texas. Oh, I love San Antonio.
Oh.
On the Riverwalk.
Is your clinic near the Riverwalk? Oh, Cape Coral, Florida. Cape Coral, Florida. Beautiful. Oh, yeah, I love that Riverwalk. All right, super.
We got some sours down there too.
Oh, you do?
Yeah, we do.
In
Okay,
Florida?
so could you turn the sound way up? Yeah. Okay, so we're gonna do some range of motion exercises after. So after we did the treatment, then what was we like to move the muscle. So one of the muscles we wanted to treat was the latissimus dorsi. So let's go clap over our head and down. Let's clap behind and clap up and clap down and clap up. Let's take the right one and let's go to the left side. We're gonna go this way and bring it back and contract it and bring it up over our ear and then behind our ear. And let's do the other side. Let's bring it back and let's bring it up and over in front. Let's bring it over our ear and let's bring it behind our ear. Great. Okay, so let's go ahead and let's reach down to our knees and come up. And let's reach down a little further and bend our knees. So bend your knees and let's come on up. And let's reach down and come up. Great. And all the way down to the floor. And come up. Great. So let's do a little bit for our multiplities. So reach, low, reach, low, reach, low, reach a little higher, a little higher, a little higher. Bend your knees. Have your pelvis stable because we're going to move the multiplities. Pelvis is stable. Take it up high and now down a little bit lower, a little bit lower, a little lower, and a little lower. Good. So let's look at our abdominals. So let's take one foot in front and one in back, and let's stretch our abdominals back. Let's take the other foot in front, and let's stretch our abdominals back. Other foot in front, and let's stretch it back. Other foot in front, and let's stretch it back. Okay, great. All right, so let's take a look, and let's do a little bit to get to the abdominals. And for the iliocostalis, we're going to do a little pelvic tilts here. Okay, so pelvis forward and back, forward and back, and forward and back, and forward and back, to the side, to the side, to the side, to the side. So your shoulders stay still, shoulders stay still, 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 forward and back, and bend your knees, forward and back, forward and back, and forward and back, and side to side, side and side. Shoulders stay the same height. Great. Now let's do a little diagonal. So let's put one foot in front, one in back. So let's pelvic tilt, diagonal, diagonal. Keep our knees bent, both knees bent. Diagonal, 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 diagonal. Other foot in front. Diagonal, 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 diagonal.
Oh my God.
Good, good. So we're moving everything around. Okay,
Good.
so we're going to take a look at our breathing again. So let's go ahead and let's put one hand on our tummy, one hand on our chest, and we're going to inhale, tummy out. Chest doesn't go up. Exhale, tummy goes in. Inhale, tummy goes out. Exhale, tummy goes in. Good. Okay, so we looked at most of the muscles, I think, didn't we? So the intercostals. Well, for the intercostals, we did that. We did them all. We did them all. Yay! Okay, great. So now we're gonna do a little special treatment. So I thought if you could pull up, take this one out, and if you could work with a Camille, and I'm gonna work with you, Elizabeth.
And I'm going to be left out in the cold again.
It's Chicago.
We'll warm you up afterwards.
Okay, so we're going to take a look at the latissimus dorsi. So let's take a look at it here. It attaches. So once you put your hips right here.
Turn it all the way up.
Against it. Yeah, just put your hips right on the table. No, just don't bend your knees. Just put your feet a little closer to the table. Yeah, great. Okay, so we're going to take a look at her latissimus dorsi. Can I have your arm? Okay. So here we are. So we're going to take a look at the latissimus dorsi.
This is a body buffer.
This is the body buffer. This is a body, a myo buddy.
Myo buddy is now it's called?
That's what they call it, a myo buddy. So it comes all the way here to the humerus, and then all the way down here to the sacrum and the ilium. And this is where she had some taut bands.
Yep, we're just polishing away those trigger points.
So we're putting a little blood supply in there. Now we're getting right on the posterior inferior serratus.
Sharon, we had a question about someone saying that
So
when they're working on the iliopsoas, that they find the legs to be very heavy, and it's wearing them out, trying to stretch the iliopsoas on their patients because it's very heavy. I think you need to raise your table high enough so that one of your elbows is planted on the table while you're doing that stretch, right?
I've never had that experience, but I'm going to be thinking about what you said.
Okay, good.
Yeah. So let's go ahead and look on the other side.
Okay.
I bet you there's a way of doing it that's not very stressful.
Yeah.
Okay, so here again, here's where it attaches here on the sacrum, the ilium, and here on the lower ribs, right here, 9, 10, 11, 12. Right there on the ribs. And let's take that up. So we're going to stretch it.
Oh yeah, the QL loves this too. Absolutely.
Oh, the QL will definitely love it. And we'll take it all the way up here to the arm. And let's take a look at the posterior inferior serratus right here. And the iliocostalis.
Anybody know why the vibration?
And the motility. Go ahead.
Why the vibration is useful?
Blood flow.
Yeah, blood flow is one.
Lymph flow.
Oh yeah, lymph for sure. Those are both great answers. How about the nervous system?
Oh yeah. I mean, everything works together.
Yeah. There's
Okay.
different types of nerves, and the little mechanoreceptors that sense vibration can inhibit pain and allow the muscle to relax.
Good, you can sit there for a second. But keep your feet on the floor. Okay, so we're going to just take a look a little bit at the abdominals. So I'm just going to put it, so this myo buddy could go slow or a little fast. So we're going to put it a little bit slow. And let's have your arm come up.
Slow is generally less ticklish, right?
Yeah, well, but how does Camille like it? Camille likes it fast.
I like it hard. Get tickled.
You can feel that your voice vibrating.
And then we're going to come over here. Take a look right here.
Now I
Getting it on the stretch.
Right. And let's go in between the ribs. Okay, let's turn around with that. So let's go, we're going to take a look at the rib. Let's go in between the ribs.
Yeah, you can use the side of this to get right into that intercostal space.
Just go in there in the intercostal space right there. Okay, this is the other side.
There you go.
Okay, so let's get right in between the ribs.
Oh, good. Yep.
Right into the intercostals.
The most important thing, believe it or not, when you're working on anybody, is that you are not putting yourself in a compromised position. Your posture and body mechanics are very, very important. The person who was saying that it was straining them to do a psoas stretch, don't do that because you're going to wear yourself out. Find a way that does not cause strain to you.
It was the psoas stretch that they were talking about?
Yes.
Okay, so I'm going to give you the easier psoas stretch because I did show you the hard one.
Yeah.
Okay, so let's do the other psoas stretch. Yeah. Okay.
Okay.
So let's go ahead and let's have you lay sideways on the table.
Yeah, you never want to compromise yourself. That's rule number one. You know how they say in medicine, first do no harm. That it's actually first do no harm to yourself. Then do no harm to your patient.
Okay, so before we were doing like a deadlift, we were lifting.
Yeah,
now
that is.
So just get your whole body straight. Your whole body straight. Like push this part forward. Okay, so we're going to take the leg back this way. So one way of stretching it is this way, instead of doing it the way I did before.
Yeah.
Yeah. So go ahead and bring your leg forward and relax, and I'll take it back. So push it forward for 15. So push 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then you could bring it back like this.
Yeah.
So nice. This is one way to do it. Also, you could treat it while you're stretching it.
Oh, yeah.
So you can get your hand right in there. You could treat it right while you're stretching it. So you find your umbilicus, come here. So you could treat your psoas in this position.
Yeah.
But again, this might be heavy just to lift the legs, so this might not be good for everyone either. So there could be, we could have lots of other ways of doing it.
Well, you can also take this
yes,
if you want to.
Let's do that. Let's do it that way. Yeah. Okay, so another way we can do it is we can have the patient with their hip really close to the edge of the table. Get me this leg
you
off the
lift that
table.
leg off the table. Like that.
We can hang like this. Can I have the stool under this foot? And so we can go ahead and treat our psoas this way while we're stretching it.
Yeah.
So this is another way that we can use it. Go ahead and put your foot on that little. Yeah. Okay, so here we go. So this would be another way of treating it, and while we're stretching it. So this would be a great way. So how could we treat our own psoases?
Psoases?
Yes, our own psoases. That'd be good to know. So here, at home when you're in bed, you could have one foot off, and then you could use your fingers. You could find your belly button. You could come just to the side, and then you could press in. How's it feel? You think you could do that? Is this possible?
Yeah.
Or we could have a little tool we could use to press in. So we could have a nice little tool. So I'll pull out a nice little tool. So stay here. So there's lots of interesting little tools we could use. Now here is protocol 15 today. So we're showing people how to treat their own muscles, and here's psoas right now. So we're putting the psoas a little bit on the stretch while we're treating it. So I'm going to give us they have a nice little tool here that she could use.
So when you hand this to the patient, you're going to put your little pen marks and a highlighter on there so that they know exactly which one, because you say, okay, you have pain key number 15, and then you circle the muscles. We found that iliocostalis thoracis was a really big deal on one side. Remember that?
What do you think?
Yeah.
And then we found that the psoas was on both sides was really significant. Those are the two super ones. How were the abdominals?
Abdominals were weak.
Yeah, abdominals were a problem too. Yeah.
So right now we're treating the psoas, and we're using a nice little tool. We're using, right now she's using a little jack tool. So here we go.
Yeah, jack number right there.
So she's treating it with the jack while stretching. Okay, so this one here. So so take a look at her. So she's using her tool.
Yep.
She's pressing in like this while she's stretching it. So she can come down here
and
like
she's
this.
monitoring her breathing at the same time. See
Good,
that?
that's good.
I need to know how to breathe. Oh my
Yeah.
God.
Breathe. This rises up. There you go.
Oh,
There
that's
we
very
go.
good.
Good.
You're doing very good. Very good. So this would be a good way to treat your psoas.
Yep.
Okay. So then to treat the other side, then you would go ahead and we put it on the other side. So let's put your head on the other side. This.
But also, it's okay to do with the knee up, especially if it's super tender. You could do it with the knee up.
Yeah.
The psoas is one of the muscles that loves to be treated on the short too.
Very good to treat it on the short as well.
Yeah.
So one way to treat it is treating it while it's stretching. Another way would be while it's on the short. Yeah.
Yep.
Okay, so again, she's going to treat herself, pressing right here.
When we're seated, we're about halfway in between contraction and
Full contraction and it's halfway contraction.
it's halfway, so it gets stuck. It doesn't shorten and it doesn't lengthen. It gets stuck halfway.
It gets stuck halfway.
Yeah.
That's the main thing that it does. It doesn't shorten all the way. It won't lengthen all the way.
Yeah, exactly.
Yeah.
What's the other muscle? What's the other muscle that's like that in the neck that causes that crick in the neck pain? Levator scapula. It gets stuck, so you can't turn your head. You can't. It gets stuck right in the middle like that.
Okay, so we're going to treat it on the short. Let's all do it on the short. So let's use your hands, turn to the side, and have yourself sit up. Oh, all right, you did it that way. That's a good way to do it. Okay, put your feet on here. Okay, and you could sit in that chair over there. No,
yeah,
you sit
torticollis,
here.
exactly.
No, you could.
And do I need a tool?
Yeah, you'll need a little tool. So go ahead and get a little jack tool. I think there's one in there. Or in the other one. Okay, so another way of treating it, we're going to find the belly button, and then you can come in and treat it like that. Press in, and then you're going to come down in here, and then you're going to come all the way down, way in there. Okay, you try it.
So you use two ends.
Well, one, I would use one.
Oh, you're just using one end.
Yeah.
Sharon,
You can find your umbilicus, come just to the side and come in there. But I think a better tool would be this one.
me too.
Okay.
Totally.
Oh, he's in agreement.
Oh, I was going to say the
That's a great
tiger
tool.
tail with
Okay.
the.
All right, that's it. We got different tools here.
terry
We got a lot of
cloth.
different tools. Okay, so we're going to try this one. Okay, so again, this one here would be find the umbilicus, come just to the side of it, and then you're going to press in.
Yeah.
What do you think of that?
Yeah, I think it's.
It's a little better than the jackknife.
And then you come in here, and so you go right in there. What do you think?
Oh, I'm just discovering a new world.
Well,
She's discovering a new world.
Yes.
no, it's.
Okay, so then here you go. You find your umbilicus.
There are all sorts of neuronal connections being formed now.
Mm-hmm.
She's becoming a more conscious person. She's going to be nicer to other people now.
Oh, wow.
And
Wow.
yeah,
Wow.
yeah.
Right there. Feel that?
Yeah.
Right there. Yeah.
You don't know how nice I am.
Oh, she's very nice.
Okay, she may be less nice now. Then.
I'm a people pleaser, so. Oh.
Okay, so after we treat it, then we stretch it. Okay, so let's do a nice stretch. So for the people, remember you said that it was hard for you to do the stretch on the patients?
Uh-huh.
Instead of you doing it on them, they do it themselves. Okay?
Even easier.
Even easier. Okay, let's have you go ahead and stand up. So that won't cause any stress on you. You just have the patient do their own stretch. Okay, so for this, you're going to go ahead and just put one leg back, and you're going to really stretch that psoas. And take your torso back, right? And you're stretching now this psoas over here.
Oh, yeah.
Okay, let's try it on the other side. Okay, get that one, and then you're going to take this one back right there. Now, a really good stretch for this throughout the day. Let's go ahead and just go straight up now. Now, a really good stretch throughout the day, so you can follow us, Justin. You follow me. Okay. Is we're going to just walk normal, and then we're going to stop and take one big stretch, one big step, and then one big step, and then walk normal, and then take one big step, and then take one big step, and so the big step is the stretch.
Yep.
But you could get that in throughout the day.
Come back at me.
Okay, so we're going to walk, walk, walk. Take a big stretch.
Yep.
Take a big stretch. Walk, 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 walk. Take a big stretch for the psoas. Take a big stretch for the psoas. Walk, walk, walk. And another great one for the psoas is this one here. Come on with me, do this with me. Let's all do it together. We'll do it in a circle.
Okay.
Okay? Come with us,
Come on,
Stephanie.
Steph.
Okay, so we're gonna do so we take the right, so put our feet in ballet position. What position is this?
I forgot. It's
Plie.
It's one of those positions. Okay, we're gonna bend both knees, Now we're gonna twist and look at your hip, and then twist and come back down. And this is really good for the psoas. So we go like this and twist, and down, and twist, and down. And come on, baby.
let's
do
do
the
the
twist.
twist again.
Come on, baby. It
Let's
goes like this. A little bit closer. Something like that. Okay, the other foot. So the other one goes in front. Okay, we're gonna bend both knees. Okay, then we're gonna look at our hip. Okay, so here we go. Look at our hip. Bend both knees. Look at our hip. Bend both knees. And look. And bend. And look. And bend. And look. And bend. And look. Okay. That's our psoas.
Nice.
And that one you could do also. Same thing. You could walk so many steps, and then hip twist, hip twist, hip twist, hip twist, and then walk and walk and walk and walk. Other foot, and twist, and twist, and twist, and twist. Okay. So that's how we do that one. Okay. How about let's do the multifidus. So let's do them on the wall, and let's do them laying down.
Self-care.
Self-care.
All right.
So you're going to lay on your
So-
back.
Which ones? We've got iliocostalis, multifidae.
So we're going to do, right now we're going to do the multifidus,
Yeah.
and we'll do the iliocostalis,
Yeah.
and we're going to do the posterior inferior
Because
serratus,
these all overlap, sort of.
and we're going to do some of the latissimus dorsi,
Yeah, exactly.
all at the same time.
Yeah.
Okay?
Exactly.
So if you can get your back knobbers. Okay, so here we're going to treat ourselves. Okay? So we're going to go ahead and come this way, and let's go across to the other side right there. And we're going to get about right there on the multifid. Now push your back down onto the tool. Now you're going to just take the tool and push it this way. Can you feel that in there? Let me just see if we're in the right spot. Let's get it right over here. Okay, right there. Okay, let's put your back down onto it. Okay, and push there. Yeah, like that. Yeah. Okay, so then you're going to go down a little bit more. Go a little bit inferior. So press your back down onto it. And you're going to come this way. And you're going to come down a little bit more. And you're going to come that way. And go down a little bit more. Okay, you can see Stephanie, she's doing it standing up. So she's going right along the spine. Okay, let's turn it. Good? So you can feel it? Good. Okay, so now we're going to go a little further. So I'll do it on Stephanie. Go ahead. Stay there. Okay, so on Stephanie, next we're going to go. So we went right really close to the spine, really close to the spine, really close on both sides. Next, we're going to go a little bit further away. So we're going to find the spine, come a little bit further away right there, and that's where we're going to find the iliocostalis right there. And so let's go ahead and also bend forward and stretch a little bit while we're on it and look for some, so you're kind of looking for some taut bands on it right there. She found some. And then come up here. Okay, so we're looking for some taut bands. We're going to reach all the way over here to the other side. Okay, so you're going to look about right there, and you're going to press your back down onto it, and then pull your tool this way. And let's come on up, and we're going to go ahead and pull your tool this way. So you do it. Look for some taut bands. So look right here, right near your shoulder blade, right there. Okay, good. Get right on that. Okay, so look for some painful spots. She found one. Okay, so I'm going to let you try another tool. So this is this is called the Big Bend. Now I'm just going to try this one here, which is just a back knobber 2. So this is a little smaller one. So see how you like that. So this one here comes, now we're going to come this way and across over to this side. So come underneath, come underneath. There. Okay, so let's go ahead and feel the iliocostalis right here. Okay, press your back down onto it. Okay, put 2 hands. Now push it that way. Okay, which one do you like better? This one or the other one?
They both hurt.
They both hurt. Okay, so we're looking for painful spots in the iliocostalis here, right there. How's that feel? So you found a painful spot there. Okay, so let's come up a little higher towards right about here. Can you get underneath and about right there? So lift your body up a little.
Right here, in the phone.
Over here, right here. Okay, so the advantage of that other metal one is that it can reach a little bit more, you know. Okay, press your back down onto it, push it that way, yeah. Okay, so now let's also get the latissimus dorsi, okay? So for that, let's have you turn onto the side, but not all the way. Let's go ahead, like, yeah, like that, yeah. So let's go ahead and let's remember I'm going to pull out a picture of it, but go ahead and you use your tool. You're going to get right onto so push it this way. There you go. So we're getting right in the latissimus dorsi there, in the back. Stretching it. You found any painful spots there?
Yeah, I don't think I have it on it though, because it's too easy.
Okay, so let's take a look at Stephanie. So here we're going to be treating all through here, Stephanie. Right through here. We can contract it and stretch it. Okay, contract it and stretch it and press in at the same time. Yeah. And we're going to look all through here. Okay, and also we'll be looking to treat the posterior inferior serratus. So again, it's a breathing muscle, and it's right here. Oh, that's a painful one for Stephanie there. Yeah. Wow. Okay, so let me feel you breathe in that one. So inhale and exhale. So breathe in right here where my finger is, where your tool is. It's a little hard, so that muscle needs a little bit of tension. It doesn't want to breathe. So that's one that's important to treat. So this is one way of treating it, but there's another great way. Let's use the tiger ball, and we'll treat it with the tiger ball on the wall. So let's try that, Stephanie, okay? So here's a tiger ball, Stephanie, and I'll use one with you. So here's, Stephanie, is your tiger ball, and let's highlight a little picture of this muscle. So here we have the posterior inferior serratus, right there. I'm going to highlight it for us. Oh, this is the way you make it not blurry. You just touch the thing that you want not to be blurry, and then it goes right to it.
Okay.
Okay, so here you can see it attaches on the ribs 9, 10, 11, and 12. And then it attaches right here on the spinous processes right here. Okay, so let's go ahead and we're going to treat that right on the wall, Stephanie, okay? Okay, so what do you think? Have you got it?
Interesting.
So you're going to go,
Can I see your?
you're going to go right from the rib. So you're going to go like right there, and you're going to get right on it, and then you're going to roll from there to the spine. And from there to the rib, and to the spine.
Oh.
Right. So how do you like the tiger ball?
It's interesting. At least it doesn't like go away or bounce away.
It doesn't fall. It doesn't bounce away, right? Yeah. Okay, so let me show you. So this is one of the muscles we were treating. And this one attaches onto the spine here.
Trying to find the ball.
11.
I can't find the ball.
And onto the ribs. So how do you think? How could you treat that part? See, it's attached on the ribs,
There it is.
and while you're stretching it or while you're contracting it. So let's try that. Let's try you on the wall too. We can see if you'd like to try it on the wall as well. Okay, so we're gonna try coming over here. So grab this. you're going to put your hand, one hand here and one hand here. Okay, so we're going to treat the this muscle right here, the posterior inferior. So let's stretch it. So bend forward, there. So let's roll this way. So get right on it. So push your back onto the wall. You're going to roll it this way and then that way towards the spine, and then away from the spine. So, but okay, don't pull so hard. Don't pull at all. Okay, don't pull on these. Just you're going to roll your body on the ball. Don't pull on these at all. Okay, and you're just keeping it from falling on the floor. Otherwise, it'll fall on the. So you can hang on to them, but don't let it fall on the floor. Okay, so I'm going to do it with you. So let me stand next to you. Okay, so you're going to pull it right here. You're going to put it on the stretch. So bend forward like this. You got it right on you. You're going to like move it. You're going to like roll on it like this. And get right on it like that, stretching it, pressing on it. So you're going to get, let's go to, and then get right on that and press it. Look for a painful spot, and then you're going to press right on it.
I usually require a lot of practice with
Okay, good.
what movements.
Okay, all right. Let's go ahead and do something else. Now we're going to take a look at treating it with a tiger tail. So let's use our tiger tail. So I've got 3 of them here.
Oh.
So here you can
Why
have
is it
one,
a tiger tail?
and you can have one. Okay.
Oh.
This is a tiger tail.
Mm-hmm.
Well, it's orange and black.
Mm-hmm. Oh, the tigers have
A tiger's tail. Okay, so we're going to take a look at the latissimus dorsi here, and we're going to come like this. So we're going to treat it while we're stretching it like this, or while we're stretching it. Let's do it on the other side. Great. All right, so let's take a look at how are we going to treat the in between the ribs. So how would we get in between the ribs? So one way we could do it is we can feel the ribs here. So get right in there, and when you, oh, you felt that, huh? So yes, so all she did was press right in there, and her eyes popped right out. Yeah. So let's go ahead. We're gonna feel. Let's go to the bottom rib. Okay. Okay. So let's go ahead. Let's go here to the bottom rib, and we're gonna come like down in here. We're gonna really feel the bottom rib and get in between that rib and the next rib there. So let's shorten them and lengthen them, and let's twist and twist. Now let's come a little bit towards the lateral. Get right there. Inhale and feel them come apart. Exhale. Inhale, feel them come apart. Exhale. Let's go a little bit more lateral. Let's come up a little higher. So let's feel let's feel the ribs. So let's get off of the iliocostalis. We're going to get right in there. And let's go ahead. Let's shorten them and let's lengthen them. And shorten them, and also let's feel ourselves breathing. Inhale, feel them expand. So that's what you want to do to treat all those multifities. Let's go ahead and treat some of them on, intercostal.
Intercostal.
Okay, let's feel the lower rib. So let's go ahead and feel the 12th rib. Let's go just above it between the 12th and the 11th rib, and let's shorten between the ribs, and let's lengthen, and let's twist, and let's twist. Twist and twist. Let's go a little bit more towards the spine, and let's twist. Okay, let's go up to the next rib. Let's go between 11 and 10. So let's go right in between 11 and 10, and let's feel it breathing. So inhale. See if you can feel the ribs coming apart, and exhale, and they should come together. Inhale. The external ones will, and then the internal ones. So exhale aggressively. Exhale. Inhale, exhale, and see if you can feel them working. Okay, let's go a little bit more lateral. Let's get in between the ribs. Let's move them. Let's move them. So they do all kinds of things. They move and they help us breathe. So they help us twist and they help us breathe. Let's go up to the next rib. Let's go between 9 and 8. or 8 and 9, yeah, 9 and 8, yeah. So let's go ahead and feel it. Let's inhale, exhale. Feel them expand, inhale, exhale. Let's feel us twist them, and let's twist, rotate, side, so let's get all in between all those ribs.
Also, guys, if you find that you're not getting enough pressure, you can always use another hand, and you can overlap. You can use this as like a tool, and you can use this, to give some added strength.
Now, many of us, maybe our hands are not ready to do a lot of work yet. Like yours might not be ready to do a lot of hands. You could do some, but not too much. So something you could do also would be to use this back knobber, and then you could get in between the ribs that way. So here, let's find our lower rib. Let's come just above it. Get between that and the one next to it, and then you could go like this and stretch and contract, stretch and rotate. Bend your knees so you're.
Yeah, that's good.
So you could use the tool and get in between the ribs, and then you don't have to use your hands, which could be important for so many people.
How much pain I have in this, and no wonder I can't breathe.
Yeah.
I don't breathe.
No wonder she says she can't breathe. Yeah,
Oh,
yeah.
my God.
And so this is what we found with everybody with reflex sympathetic dystrophy or regional pain syndrome, is they had this underlying perpetuating factor.
And they were nurses.
And so many of them were
Thank
nurses. They were
you.
so that they drink the Kool-Aid, right?
Yeah.
Okay, so this was so important to get them back to work too, just like it is to get you back to work. It's going to be important for you as well. Okay, so we're coming to the end of our program today.
Yes.
So remember, next week it's low back pain, and you want to have little balls to do for things on the wall, and we want a bigger ball like this, not too hard, to use on the floor.
Could it be a large softball?
It's a softball would work for some people.
Other people
But
need
that,
even
but that's
softer.
You need a lot of people need something softer than that.
Softer.
Yeah, so a softball, 16-inch softball, like about this size, is great. So that would be great for people that want a little bit more pressure. But many of us might want a softer ball, like a fit ball, a black fit ball. Another ball we might use would be a ball this size. But this is a little bit, these balls here, but they press in harder. So this is more advanced, but so the balls this size or the balls about like this size here would be our best balls for next week. Okay, for low back pain next week, right? And you also might want to pick up the book Trigger Point Therapy for Low Back Pain, and you can get that from Amazon. Yeah. Okay, we've got our song. We're going to do it at the end now.
Here, this is the.
Oh yeah. Let me have the book.
Sharon and Justin from Pain Free who want you to remain free.
Pelvic tilts. Pelvic forward and back.
And come forward and
Back. Forward. Back. Side right. Side left. Side right. Okay, so let's just restore us on the right.
to do self-care.